Well, I'm absolutely delighted now to be joined by Dr. Clemens, who is the chair of the Data Committee. Well, first of all, Dr. Clemens, thank you and welcome.
Thank you for having me.
Nice to see you on this beautiful sunny day.
Yes, absolutely.
Now, I'm walking around this conference centre and I'm seeing AUA everywhere, plastered everywhere. So what is AUA?
Well, it stands for the AUA Quality Registry, which is a registry that's being developed by the AUA to collect data nationally from practices across the country. Initially, we're focusing on newly diagnosed prostate cancer, but the plan in the future is to expand to other urologic disorders, and ultimately, I think, to have a very comprehensive registry that really gives a good picture of the patterns of care and quality of care that's provided by urologists across the country.
Why this initiative and why now?
Well, there was a clear need for urology to take ownership of our own data and to be the one in the driver's seat when it comes to answering questions about how we care for patients, to be able to demonstrate that we do in fact care for patients and that we have an interest in demonstrating that we do provide good quality care. Many times we find ourselves reacting to statements that are made by other outside bodies, and it's somewhat hard to react if you don't have data that you can use to back up your point. So that's kind of on a national level. Also, we've been hearing a need from individuals and members to say, we'd like to participate in something where, something like this, where we can get assistance in putting our data together, providing feedback. So in other words, some practices don't know how many patients they see with a certain disease or what their practice patterns are. This provides an opportunity at the individual practice level for groups to provide, provide their data to us. We then provide it back as information to them, where we can tell them, how many patients they see with this or that, how they practice in terms of how they treat their patients.
Right.
And then the next step, of course, is to provide metrics to them that are de-identified and totally anonymous, that they can look to see how their patterns of care and how the quality of their care, if you will, compares to their peers.
Right.
So it's really, the need was not only at the national level, but also at the individual practice level.
I'm with you. Now, I understand it's going to be rolled out in phases. How's that going to work?
Well, like any new endeavor, you want to start slow, and you want to initially work through the nuts and bolts of things. So what I mean by that is the first number of practices which sign up will help in the development of the registry, because we have our ideas essentially at the AUA about measures and data that we would want to collect, but we need to get feedback about how that is going, where are areas that maybe could be improved or added to, and that aspect. So the initial phase is really getting the system up and running, and then of course the next phase is the growth phase, where then we ultimately are able to provide a large amount or gather a large amount of data and provide comparative metrics to the various practices.
Okay. Well, finally, how do patients get involved with all of this?
Well, one of the most exciting things about this is the incorporation of patient data, which is novel, and to our knowledge has not really been done at a national level before. So the concept is that the registry, the AUA, would obtain permission from practices and from the individual patients, and then we could interact directly with the patients through a web interface. All of this will be conducted by a vendor who is hired by the AUA.
Right.
But the idea then is patients could be contacted electronically and complete information about how they're doing, patient-reported outcomes, and that data could then be collected by the AUA and provided back to the practices. And that way, when the practices are seeing patients in the office, they have that data they can refer to.
Right.
And of course, it also is one additional aspect of demonstrating that we, as a field, really do find that patient-reported outcomes are important, and we are interested in improving outcomes for our patients and not just reacting to policy-driven issues. And so that's going to be an important part of the registry that we're planning from the beginning.
Such an exciting initiative, and thank you so much for taking the time to talk to us about it today.
Thank you very much for having me.